Well, the Navajo Nation has been one of the hardest places hit by the coronavirus pandemic. Just this week, the nation identified 75 communities with a, quote, uncontrolled spread of COVID-19 in the first 2 weeks of January. Joining us live this morning is Navajo Nation President Jonathan Nez. Good morning, President Nez.
Good morning, Rachel and Joe. How are you?
We're doing great. Well, Navajo leaders have said that this recent outbreak is likely due to people traveling, family gatherings, things like that. What are you doing now to try to help get things back under control?
Well, we are still in a mask mandate here. We started that in April of 2020. We do have some very strict protocols in place here on the Navajo Nation. We have some weekend curfews that have helped us bring those numbers down. And we did have to do that through the holiday season. And we see some hope and some light at the end of the tunnel, as they say here on the Navajo Nation. You know, overall, we've received over 57,000 vaccines. And as of yesterday, 56% of those vaccines have gone into the arms of our Navajo people, 32,000. And those are the Pfizer and the Moderna vaccines.
The big push right now is vaccinations. The Navajo Nation has already been giving vaccines, of course, to people 65 and older, medical personnel, spiritual leaders. They're all part of this 1B phase, which I understand. There was some news out of Washington over the last day that the previous administration that just ended, the Trump administration, didn't have clear plans for vaccine distribution. How would you rate the Trump administration overall and how they've done and did the past year?
Well, we know, as others there, that some of the dollars that were supposed to come to tribal communities took some time before it arrived. And we even had to file a lawsuit in order to get our share of dollars in Indian country. So those were some challenging times, but we tribal communities throughout the country had to use our resources at hand and use them efficiently. And I applaud Indian Health Services and all our healthcare providers for using their limited resources throughout these trying times to protect our citizens. And you know, I think as was you saw on the news, that there is a new administration in, and with the plan that has rolled out with the Biden-Harris administration to get more shots into the arms of all people, will not just help Native Americans, but help everyone here in tribal communities. But we were fortunate that we got our vaccines the same times as states. Again, 56% of what we receive have gone into the arms of our citizens, and some other states throughout the country are in a low percentage of getting their vaccines out. We are getting our shipments almost on a weekly basis, and our healthcare workers here on the Navajo Nation have done an outstanding job of doing these vaccination blitz and vaccination events here. And 65 and over, we did the 1A. We're following the same protocols as the CDC recommendation. We're in 1B, and now we are moving to get our teachers vaccinated, as well as our business and our government essential employees as well. So,
yeah, so important.
I was out there on the Navajo Nation watching this firsthand, and I'll be doing that today as well in Shiprock, New Mexico.
And I know you talked about the strict lockdowns. You're still under one until Sunday. But with the surge going on, are you anticipating having to issue yet another lockdown? And at what point would you be happy to get to a point where you feel comfortable opening things up?
Well, this will be our last weekend lockdown this coming weekend. And so we are reevaluating that, because our healthcare facilities are saying that, you know, they have to juggle the testing as well as the vaccine distribution from Monday through Friday, and then also take care of our patients here on Navajo. And they have recommended if it would be okay to open the weekends back up for vaccine distribution. So we have made that decision so that the weekends will start opening back up and really focusing on getting the vaccines out in our communities.
And, you know, tourism is a big part of the Navajo Nation's economy. We know places like Monument Valley and Antelope Canyon remain closed. And you're a marathon runner. I know that you celebrate the events that you've held there in the past, the races, the festivals. When do you think things will start to open back up? And what's your advice to people who want to visit the Navajo Nation?
Well, of course, the health and well-being of our Navajo citizens is of utmost importance to leadership here on the Navajo Nation. It is very hopeful. I mean, if you have 57,000 vaccines available and 32,000 have been put into the arms of our people, you know, the more and more we start getting the shots out to our citizens, and then we will be looking at our gating measures to reopen maybe 25%, 50%, 75%, and then the full reopening of our nation and our tourist destination. And we're hopeful that we could do this before this upcoming tourism season. Last year, we got hit hard. We had to close our tourist destination. But again, you know, we have lost over 900 of our Navajo citizens, and that was our focus and our priority. And I think if it wasn't for the quick action of our leaders here on the Navajo Nation and our people, these numbers would have been a lot worse.
President Nez, thank you so much for your time. We really appreciate it. Thank you for keeping us updated with the progress that you're making there on the Navajo Nation.